Aloha, this is Everyday Wellness and I'm Dr. Lisa Kim. We are joined here today by Dr. Kristen Coles, a naturopathic physician and a licensed acupuncturist. Thank you for coming on the show.
Thanks for having me.
Well, today we're going to be talking about the IV therapy, and this is a nutrient therapy that it's not an IV that you get from when you go to an ER, but can you explain a little bit about the IV nutrient therapy, what that is about?
Absolutely. IV stands for intravenous. Okay. And so this is getting nutrients like our regular vitamins, we'll get into that, via the vein. Instead of taking something orally, we can actually access your cellular system by putting nutrients into a vein.
And why would you do the intravenous therapy rather than doing the oral dosing, the nutrients?
There's a lot of different reasons why we might choose intravenous over oral. Some of those include gut issues.
Okay.
So if we're someone who has a lot of issues in our gut, things like Crohn's disease, things that impact and impair our ability to absorb nutrients along that gut wall, we often might need to supplement nutrients via an intravenous route. Other reasons might be chronic health disease, chronic diseases, things that we have been dealing with a long time that we are just not getting better from. These diseases, certain ones of them, require different types of nutrients and sometimes very large amounts of these nutrients. And often inside our gut, which is where all of our food and nutrients and supplements go, we only have a certain number of receptors to absorb that nutrient. Okay. And things like B12, for instance, have to be absorbed in a very specific part of your small intestine. If that area of your small intestine has been injured or it is under chronic inflammation because you have chronic gut issues, you are not going to absorb B12 to a very good extent. And we then have to think about doing things other than just oral supplementation to get that B12 into your system. There's a lot of other examples, things like magnesium is another really big example. Magnesium is a critical nutrient mineral. And it is used in over 300 different enzymatic reactions inside a single cell. So one single cell uses magnesium for 300 different reactions. And think about how many cells we're made of.
Exactly.
So as you can understand, magnesium is a crucial mineral.
And when you take this orally, a lot of times it causes diarrhea, even in small dosages, like 2 or 3 pills, and then a lot of people, it can trigger diarrhea or loose stools in them. And so can you explain to us why that might be?
Absolutely. So magnesium, when we take it orally, it goes inside our gut, and when it gets to the large intestine, that's where absorption sites for magnesium are. And we only have a certain number of absorption sites. So let's say we take 500 milligrams of magnesium at one time. We might only be able to absorb a fifth of that dose, depending on our system. The rest of that magnesium never gets absorbed, meaning it never leaves your digestive tract and goes into your body because all your sites for magnesium to bind have already been used up. Okay? The rest of that magnesium is then sitting in your large intestine. And magnesium is a mineral that our body is familiar with, and when magnesium is sitting in the large intestines, we will actually push water out from our body into our intestines and create diarrhea. So it's all about the bowel tolerance. That's a very common sort of lingo that we use for things like vitamin C and magnesium. They both have the same side effect. You take too much vitamin C, you take too much magnesium, both of them is going to cause diarrhea at some point. And that's your bowel tolerance. That means we've breached the amount of receptor sites and now nothing else is being absorbed. So when you think about that, you think that we can only absorb so much magnesium in the gut. And if we are requiring a lot more magnesium inside our cells, how do we get that in? Now, you might wonder, shouldn't a regular diet and the amount of magnesium in your diet be sufficient for all of us to upkeep these enzymatic processes? Yes, I mean in an ideal world. 20 years ago, 30 years ago, we were actually eating around 500 milligrams of magnesium in our food on average. That statistic has gone down to about 125 milligrams per person a day of magnesium in the diet. A huge decrease just in our dietary intake of magnesium.
Right.
And that alone can cause a huge deficiency in our intracellular magnesium. Now, the other thing, stress. Stress is ubiquitous. Every single person who walks in my office has some level of stress, and often many of them have levels of stress that are impacting their health. When we are under stress, we actually cause our kidneys to release extra magnesium and we urinate it out. We lose magnesium, and we lose extra magnesium when we're under stress. So our body actually is getting rid of it, and that has to do with the catecholamine adrenal cascade of hormones. We don't need to get into that. But there's very particular reasons why our magnesium gets lost when we're under stress.
So is that kind of the same concept as, before the examination or before like you go on a stage, all of a sudden you got to go, to the bathroom?
Similar hormones at work.
Right, exactly, right? I mean,
Yes.
that's kind of like something that we can relate to.
Yes.
Right.
Yes.
But if you are having chronic stress, I mean, this is going to be released over and over and over again, and you'll no longer have the supply that you need in your body.
You combine stress, and what do we do when we're stressed? Do we eat really well when we're stressed?
Right, exactly.
No, most of us don't.
Exactly.
I'll just tell you what I see. Most people, when they're really stressed, they're not eating well either.
Right.
And we combine a lot of stress with a diet that's probably very low in magnesium,
Right.
and a majority of people are set up for very deficient magnesium stores intracellularly. When that happens, we can develop diseases.
Right.
And we can develop specific diseases that have been shown to have a magnesium deficiency. We'll talk about a couple of those. Migraines are one of them. We know that 60% of migraine sufferers have abnormally low levels of intracellular magnesium.
Right.
So we'll get into that a little bit. But there are very specific things that a deficiency in magnesium will cause in your health. When all of that is occurring, we need to think about other ways to get magnesium into the system. Oral dosing is often not sufficient enough.
Right.
And it will give us side effects of diarrhea, and people don't want that either.
Right.
So we then turn to intravenous forms of magnesium. There are a number of different ways that we can get magnesium into the system. At my clinic, I have an IV nutrient clinic. So I have an intravenous nutrient clinic where I am doing intravenous nutrient therapy on a number of different people for many different reasons. And we have these things we call cocktails.
Right.
And they're not the cocktails that you're thinking about for, happy hour and your end of the day. These are a better type of cocktail, actually. And these are IV nutrient cocktails. And I'd like to talk about a few of those.
Okay,
I'd like to talk about the Myers cocktail and an immune cocktail and the migraine cocktail.
Okay, great.
Okay, so I'll start about the Myers cocktail. And the Myers cocktail has been around for 50 plus years. It was pioneered by a Dr. Myers who was out of Maryland, and he was using a combination of very specific nutrients and vitamins and minerals, using them to inject into the vein to help improve health. Okay, so at my clinic, my Myers cocktail is given in what's called an intravenous push. So it's not like a huge drip bag of nutrients. It's actually a smaller syringe, and it has magnesium, which we were just talking about. It has calcium. It has your B vitamins, so dexapenthenol, pyridoxine, that's B5, B6, a B complex, B12 often, vitamin C, ascorbic acid, sodium bicarbonate, which is a buffer and an alkalinizer, so it helps alkalinize your system, and then sterile water. All of that's mixed together, and then it's injected into the veins over about a 20-minute period.
Okay.
That is basically a starter IV. So, many people might have already heard about a Myers cocktail. It's kind of been around the block, and it's fairly familiar. It is an incredible way to boost your energy, to help with relaxation, to help with the immune system and to help with sort of aches and pains. I use it for women who are having, you know, cramping in their periods. It can be very useful. It can be useful for depression, anxiety because of the B vitamins. The Myers cocktail kind of has a broad spectrum of use.
Great.
And some of the big players in that are the magnesium and the vitamin C.
Sure.
I have many of my patients come in and they want, you know, they call me up and they're, you know, Doc, I need a Myers cocktail. I'm about to get on a plane tomorrow. And it's one of the #1 things I recommend for pre and post travel, actually.
Great.
It's a great way to just boost levels of your nutrients inside your system without having to take a huge amount of oral supplementation.
Great. And do you ever, I mean, this is probably going to be very, very rare, but like if they happen to have a very high dose in their body, if they were very high in certain, you know, minerals or vitamins, and you put that Myers cocktail in their body, could that actually have side effects to it as well? I mean, have you had cases like that?
Well, that's a great question. And in my practice, no one gets an IV nutrient drip of any type until I have done blood work on them.
Great.
So I look at the liver and I look at the kidneys and I look at the electrolytes.
Okay.
So, you know, calcium is a common electrolyte. So we need to look at all those levels to make sure that there's not a contraindication. If we have kidney issues, we don't want to do intravenous nutrients because that dose is going to go straight to your kidneys. It's not going to be filtered by anything like when you take oral supplements.
Right, right.
And we want to be very, very careful to make sure that our kidneys can handle that nutrients and that our liver can do it and that our electrolytes are well balanced. So, you know, as long as whomever you're seeing for any type of IV nutrient therapy is doing those initial labs to make sure everything is okay and there's no contraindications, generally there's not going to be a lot of side effects.
So depending on the patients, do you change the dosing of like certain vitamins?
Absolutely.
Great.
Most everything I do in my practice is very much individualized medicine. And everything is made fresh right before it goes into the patient, and I have the ability to increase B12 if B12 needs to be a little higher, or increase B6 if there's, you know, depression. B6 is great. I can also increase the vitamin C a little bit, and that is kind of will segue into the immune cocktail. Vitamin C, or ascorbic acid, is an incredible nutrient for the immune system.
Right.
Many of you probably heard about, oh, if you have a cold, take some vitamin C.
Right.
And it's actually true. Vitamin C is very, very useful for boosting the immune system, helping fight viruses, helping fight bacteria. And when we do it in an intravenous form, we can highly surpass the amount that we can absorb orally. In an immune cocktail, which is just a variation of the Myers cocktail where there's extra vitamin C, we can have, you know, 2 grams of ascorbic acid up to, you know, 6 grams of ascorbic acid, where if you're taking it orally, and let's say you take 1,000 milligrams or 1 gram, you're probably only absorbing 500 to 600 milligrams of that. So we are essentially more than doubling that dose.
Yeah, but most of the people are taking probably about 1,500 milligrams and more of vitamin C, and you know, I've seen even cases up to like 5,000 milligrams a day, and they're not absorbing all that. But so what is that? You know, where is that all going to go to, right?
Yeah. We can only absorb however much receptors we have in the gut, and what we know is that that's actually a very limited amount. And if we want to get higher levels than that, we have to think about things like intravenous nutrients. And using an immune cocktail when you're under the weather, or having a cold, or having a flu, or having a sinus infection, any of those things, my patients are trained to call me up and get in the office that day to get an immune cocktail. And I swear by the immune cocktails. I actually use them myself, and I have had a few times in the past 2 years where I've felt like I've been coming down with something. The second I even feel an inkling or I even have a thought
Right.
that I might be coming down with something, I do an immune cocktail, and generally I will go home that night and I will have an incredible sleep because a lot of those nutrients in there really help with sleep.
Right.
I will have an incredible night's sleep and I'll wake up the next morning and forget that I even felt anything.
So what else is in the vitamin or immune cocktail other than vitamin C?
So we have all of our nutrients that are in the Myers. So we have the magnesium, we have the calcium, we have our B vitamins, B5, B6, B complex, B12, which also we can change that dose because B12 is another very good nutrient for the immune system. And then we have our vitamin C. Sometimes we can put selenium in that immune cocktail. Selenium is another micronutrient mineral that helps with immune system things. And then sodium bicarbonate and sterile water.
Okay, great, great.
Yeah.
And you can do this to prevent as well as, do you usually use it to prevent a flu or cold, or do you normally use it when you have the flu and cold?
We can do either. I've had patients who, for the duration of the cold and flu season, they decided last year that they weren't going to get the flu vaccine for personal reasons, and they came in every single week for just a Myers immune cocktail, and that person did not come down with the flu this year. And there has been some research into the Myers cocktail in prevention. There's also been research into shortening the duration and the severity of cold and flu. So either one can be used. I like prevention, and I think, as much as you can do to prevent is great.
Well, if you think about it, flu vaccines are prevention in a lot of the conventional world. And that can be seen as a prevention of flu as well. But to me, it makes more sense to boost up the overall immune system rather than just, giving the body that one, bacteria or virus or whatever it may be in the flu shot. And then, hopefully that they won't get that. Because that just makes no sense to me. But it is a personal choice, and I am wholeheartedly with you on boosting the entire immune system.
Yeah, and if you are getting these nutrients every week or every 2 weeks, you're really focusing on making sure that the cells in your system and your immune system cells have all the resources they need, that if they do come in contact with a virus or a bacteria, no matter if it's the flu or something else, that they are already on full alert and that they are already going to go with full cylinders running to create a response and fight that and not have it be something that really takes over our own system and runs us down. So these nutrients can do that.
And what is the youngest age you would take for something like this?
That depends. That's a personal choice as well. As long as we look at the liver, the kidneys, the electrolytes, those have to be done no matter what. And then I change dosages based on weight. So if I have a very young patient or a very small patient, sometimes the dose is going to change of those nutrients. But, many children don't really like the thought of having a needle in their arm for 20 minutes. So in those cases, sometimes if we have to get nutrients in, I'm going to think of something more along the lines of just a quick B12 shot.
Sure.
But age doesn't really matter. It's more about the vein and, changing the dose for their weight size and having them be amenable to the treatment. Right.
And what if you know that this would be beneficial for those patients, but then they didn't quite make the stats, on their blood work, because they got either weak, kidneys or the liver, then what other options do you have for those patients?
Yeah, well, that gets kind of into the details, patient to patient. But first, if we uncover something in liver and kidneys that they didn't know about, well, we need to investigate and we need to make sure that we start helping their system reboot because there's something going on there. So we need to investigate that. There's other things we can do. Muscular injections of nutrients. Actually, it's called IM, intramuscular. So instead of going straight into the vein, we can actually do muscular injections of things like B12, other B vitamins, B6. We can also do magnesium. Actually, can be done intramuscular. So there are options there, and they're not going to be processed so quickly by the kidneys and the liver.
Oh, that's great news
Yeah.
for those patients who need it. I am fascinated about this with the migraine cocktail.
Yes.
So could you explain to us a little bit about that?
I am just so excited to talk about the migraine cocktail. I have had a 90% cure rate with using this migraine cocktail for chronic and acute migraines in my practice. And the main player in the migraine cocktail, you might have guessed, I alluded to it earlier, it's magnesium.
Right.
And there is a huge dose of magnesium in this cocktail. And there is also some B6, vitamin B6, and calcium. And then just 3 ingredients, and it's mixed with sterile water. This is best done when people are in the prodrome of